I want to talk to you first about, let's see, this is our cancer center. If anybody knows, the building used to be the old um, movie house. So we're now 11 floors, and we're not showing any movies. But the inside is like an encounter circle. You can meet all your friends and relatives, people that you may not want to meet. But it's a wonderful architectural delight. But more importantly, the people in it are very capable, and we have up to date, very sophisticated types of equipment and treatment and all sorts of protocols. So for any of you who have been there, you recognize it. Now, just a little bit about cancer survivors, and I think that's very exciting. There are going to be more cancer survivors than those diagnosed with cancer in 2050. And that, I think, is a very, very important statistic. But we also know that there are a lot of people who have early cancer who have very excellent prognosis, good prognosis, but they have poor outcomes. And it's not just about cancer, it's about, in general, a lot of things, a lot of chronic illnesses like diabetes and heart disease, et cetera. So this is like very, very interesting and important now. It's about health literacy. It's about being able to comprehend, being able to understand, being able to fill out information and understand what people tell you about your health so that you can make decisions. And this is a landmark study from the Department of Education in 2006 that reported only 12% of adults in the U.S. have proficient health literacy. So again, obtaining, processing, comprehending the information that you're given. So that's why we call it health intelligence from head to toe. It could also be health literacy from head to toe. And one of the things that you can measure health literacy is actually by reading an ice cream label. I know you're going to say, oh my God, that sounds ridiculous, but it's true. And this is one of the measures that we're able to identify people who may not understand reading comprehension or numeracy. And maybe these are people who need some extra care. Maybe this is someone who needs a navigator. We're not at that point yet. But across the country, there are many researchers looking at ways to figure out who needs what and who may not understand what kind of information they're given. So in a very interesting study out at Kaiser Permanente in Colorado, in the heart failure unit, and there is something called a heart failure unit, there were 1,500 people in this unit, and they were asked three very, very basic questions. Questions like, who fills out your forms? Do you bring your glasses? Very, very, very basic questions. And the people who did not do well had an increased morbidity and death from heart disease. So that's how you can figure out that it's not a great leap to know that if you don't understand some of the very basics, you may not understand what people are telling you about how to keep yourself healthy or how to follow up with the disease that you're diagnosed with. So let's just have some fun and look at this ice cream label. I know it very well. I don't know about you guys, but I should be an expert on this. So just take a look at the total fat, look at the amounts per serving, look at the carbohydrates, and I'm going to just ask you a question. So if you eat the entire container, how many calories will you eat? So 1,000, right? Because each serving is 250 calories, right? You can see that. See, 250. Okay. Second, if you are allowed to eat 60 grams of carbs as a snack, how much ice cream could you have? So 60 grams of carbs. So each serving is 30. So 2, right? Or 1 cup, because 1 serving is half a cup. But it's not a leap either to get one of these wrong, right? If you have dyslexia, if maybe you're not good at numbers. If your doctor advises you to reduce the amount of saturated fat in your diet and says you can only eat ice cream, you usually have 42 grams of saturated fat each day, which includes 1 serving of ice cream. If you stop eating ice cream, how many grams of saturated fat would you be consuming each day? Stop eating. So let's see. Saturated fat, so it's 9 grams, right? And if it's 42 and you have to reduce 1 serving, then it's 42 minus 9, which is 33. Okay? Yeah. So, it's not a stretch to see one of these assessment tools can really define certain people that, may need some extra help with if someone is explaining certainly numbers. If you take this treatment, you will get this advantage. If you don't take this treatment, but you take this protocol, then do you see? And sometimes it's, very confusing. If you eat 2,500 calories in a day, what percentage of your daily value of calories will you be eating if you only eat 1 serving? So what do we say? We said 1 serving was 250. So 250 and 2,500, 10%, right? And then the last question is, pretend that you're allergic to the following substances: penicillin, peanuts, latex, gloves, and bee stings. Is it safe for you to eat this ice cream? So let's go back, right? Okay. What do you see here? That's right, peanut oil. But this also is very important for people who have a lot of prescriptions. So a lot of prescriptions, you may not be able to understand what you should be doing, what you should be taking. And that's another test. They ask people to put all their prescriptions in a brown bag and bring them out and explain why they're taking them. So, this is very exciting field. At least I think it is, and I think it can identify people who you don't, English can be your first language. You could be a CEO of a company. I gave this to my girlfriend who runs a jewelry company, very successful. She's a diabetic and dyslexic, and she failed it miserably. Very successful. So, but in medicine, she may not be as successful when she talks to her doctors. Okay, now let's go on, and I want to talk about what I'm supposed to be talking about. Okay, so just a few things. We'll talk about some things about alcohol and about weight. Do you drink alcohol? It's not. Oh. Do you drink alcohol? Well, you may not drink, but a lot of other people have something. Okay. So we have everybody here. And so we're split. Most of us don't drink, about 58%, and 42% do. But if you do drink, how many glasses per week do you consume? Oh, do I have to click it again? Okay. Okay. So most people really drink in moderation, and that's good. Even though the American Heart Association allows 2 glasses of wine a day for men and 1 for women, I like to temper it a little bit and say 3 to 4 a week. If you don't drink, don't start, right? And do you exercise? So most people exercise. And when the Office of Survivorship in the National Cancer Institute asked people, about a third of people exercise. It was really low. So we have a very healthy crowd here. And if so, how often do you exercise? Oh. every day. That's pretty good. So there's a lot of benefits, obviously, of exercise, and it's good for your cardiovascular system. It's good to reduce the risk of cancer, particularly in my field, in breast cancer. It may enhance your natural killer cells. There's a lot of reasons why you should exercise. And are you overweight? Yeah, so we could always do a better job watching our weight. There are some people that have a set point, and I don't think that that's a bad thing. You don't have to be skinny mini, but if you maintain a weight, you don't yo-yo, you don't drink too much, and you exercise, those are all good things. Your BMI could be a little bit on the high side as long as you exercise. So if you are overweight, would you say that you're overweight? Or if you're obese with a BMI of over 30, we just define it as kilograms over meter squared over your height. So anything under like 25 to 30 would be overweight, and over 30 would be obese. When you go to the doctor's office, it's actually very good to know what your BMI is, and they measure it. So when they do your height and your weight, it's very good to ask them, what is my BMI? I saw a woman with a BMI yesterday of 66. So most people are just overweight and not obese. What percentage of Americans are overweight or obese? What do you think? Give me a shout out. Yeah. Yeah, who said 70? Yeah, so you're right around there. 63% in the U.S. are either overweight or obese, and the breakdown is that almost 37% are overweight and less 26.5% are obese. Do you smoke? Yeah, the majority of people do not smoke. In the Office of Cancer Survivorship, when they asked people, about a third of people did smoke. Across the country, very different patterns. So, help, I need an operator's manual. And sometimes you can really feel like that. You just don't know how to listen to your body. You don't know what to do in keeping yourself healthy, because every day seems to bring another news release about, how to reduce your risk of cancer, what's good, what's not good. I think that many, many years ago, they said eating lemons would decrease your risk of developing AIDS. Crazy stuff. So I'm going to talk a little bit about oral head and neck cancer awareness, and I'm not a head and neck surgeon, but I just wanted to pull out some interesting facts. So the things that increase risk for head and neck cancer and oral cancer, so anything from here up, including the pharynx and the larynx, are tobacco, any type of tobacco, cigarettes, pipe smoking, oral tobacco, including chewing tobacco or snuff, alcohol. 7 out of 10 patients with oral head and neck cancers are heavy drinkers. Betel quid. Anybody ever hear of betel quid? I think it's I think that a lot of places in Southeast Asia, Vietnam, South Asia, chew on this. So it's betel quid and gutka. Sometimes they wrap it in tobacco, which is just an added bonus maybe. HPV, so we've all heard of HPV, human papillomavirus. Dr. Tesla will talk about that as well. There are more than 150 types of viruses. Some people call them warts. They're not cancer, but signs of HPV infection are found in 2 out of 3 oropharyngeal cancers, and to a lesser degree, just in oral cavity cancers. Most of the people who have these infections are young, less likely to be smokers and drinkers. The cancers have a better prognosis if they contain the HPV DNA. HPV can be spread through oral sex, vaginal and anal intercourse, but it's a skin-to-skin contact. If you use tobacco products and drink alcohol, how much does your risk of head and neck cancer increase by? And I think this is like pretty surprising. 100 times. Very good. That's the right answer. Okay. Other risk factors, so just a little bit more, it's twice as common in men than in women. Most patients are older than 55, though the ones who have HPV type of cancers are younger. Cancers of the lip are more common in people who have outdoor jobs and also pipe smokers, smoking pipes, who have poor nutrition, weakened immune systems, particularly after stem cell transplant. Lichen planus, which are these plaques, like whitish plaques in the mouth, that can also increase your risk. And there are different types of genetic syndromes. So what can cause oral head and neck cancers? Mouthwash, irritation from dentures, alcohol, tobacco in both, or both, HPV infection, or C and D. Okay, we got all that right. Of course, yes. And that all goes to how deep the cancer is. And whether or not there are lymph nodes. And so it all depends also on like the pathology of the cancer and what kind of grade the tumor is. So a lot of it is, the type of pathology. But yes, they are curable. So other signs and symptoms include a sore in your mouth that doesn't heal or increases in size, persistent pain in your mouth, the lumps or white or red patches inside your mouth, thickening of your cheek, difficulty chewing or swallowing or moving your tongue, changes in your voice, a lump in your neck, bad breath, difficulty moving your jaw or swallowing or pain in your jaw. Do you go to your dentist on a yearly basis? I should have. As I was telling my dentist as she was working on my mouth yesterday, I should have been seeing you every year. Okay. Sorry? Yeah, okay, well. So how are we doing? Yeah, so that's good. You should be going. My dentist said every 6 months. I think every year is fine. And this is just an example of what you should be looking for when you go to the dentist. When you go, the doctor or the dentist could examine your mouth. But particularly if you have any signs or symptoms, you should bring this to their attention. So a little bit about skin cancer. The most common cancer is skin cancer. 1 in 5 Americans will develop skin cancer in the course of their lifetime. There are 3 main types. The most common is basal, then squamous, then melanomas. Melanomas occur on the trunk, the chest, the back, the legs, the neck, the face. Exposure to UV rays are a major risk factor for most cancers, and they're strongest between the hours of 10 a.m. and 4 p.m., and they're very strong during the summer and spring. They reach you more at ground. They reach the ground at higher elevations. And UV rays can get through even on a cloudy day. So when you go out on a summer day, even if it's cloudy, you should wear your sun protection factor lotion. People who work outdoors have a higher risk of skin cancer. Frequent sunburns in childhood may increase the risk for some types of cancers even decades later. Whoever used one of those reflectors? Yeah. Using a tanning bed is very risky, and if not even more risky than sun tanning. So you have to be careful about that. I would advise against doing any of that, any tanning beds. But interesting, any lotion, any tanning lotion to make you bronze or to make you darker does not increase the risk. Yeah. Yeah, I think it's like for a very short period of time, so no, I don't think so. I'm going to find out about that, but I don't think so. Because I heard that asked to a dermatologist who said that. So skin cancers, simply staying in the shade is one of the best ways to limit your UV exposure. But if you're going to be in the sun, slip, slop, slap, and wrap. That's the catchphrase. You slip on a shirt, you slap on some sunscreen, you slap on a hat, you wrap some sunglasses to protect your eyes and your skin around them. So don't use any SPF under 15. I think that 30 would be the recommended. But if you go above 30, it probably doesn't make much of a difference. I don't know. I'm not a dermatologist. I mean, like if the sun's coming through. Yeah, I mean, I know that they make for outside, they make these special hats with UV lotion in them. Did you ever hear of that? And also clothing. I think it's okay to be, you know, in a room that's glass. I mean, you're not baking in the sun, are you? So push down the shade. I don't know. I don't know what to. Yeah, I think it's a good question. I don't know the answer. I'm really sorry about that. I'm doing the best I can with the skin. How many sunburns have you had? Okay. Yeah. I mean, that's not difficult, right? In your lifetime, over 5. But on average, a person's risk for melanoma doubles if he or she has had more than 5 sunburns. And then I'm not going to go through this whole thing, just that melanoma is the most common form of cancer for young adults between the ages of 25 and 29, and it's the second most common for young people between 15 and 29. Regular daily use of sun protection factor of 15 or higher does reduce the risk of developing squamous cell cancer by 40% and melanoma by 50%. Women age 39 and over have a higher probability of developing melanoma than any other cancer aside from breast cancer. And there are 13 states now in the U.S. that prohibit indoor tanning for minors under the age of 18. People who first use a tanning bed before age 35 increase their risk of melanoma by 75%. What percentage of a person's lifetime sun exposure is acquired before the age of 18? Okay. Yeah, it's 80%. It's 80%. Let me just show you why. It's contrary to popular belief, but 80% of a person's lifetime sun exposure is not acquired before age 18. Only about 23% occurs by age 18. And if you look at this, this is just a breakdown that I thought was very interesting. So you can see here that only like 22%. So most of it is acquired after the age of 18. And so we have to be smart about what we do in the outdoors. Okay, something that I am very familiar with is breast cancer. And just to go over this, do I have like another 5 minutes? Okay, so we know that there are certain factors that definitely cause breast cancer. We look at it like a triangle. So up here are the causal factors. These are the things that we really can't do anything about. Exposure to ionizing radiation, like in Chernobyl, which increased the risk of thyroid cancers, leukemias, whether or not you inherited a BRCA mutation or many other mutations. You know, we can't pick our parents, but those are direct causes of breast cancer. There are vulnerable causes of breast cancer. The vulnerable causes include whether or not you have a precancerous lesion or when you started your periods early, if you stopped them much later. So those are the things that are hard to change. Even, pregnancies, nobody gets pregnant to say, I want to reduce my risk of breast cancer. But there are contributing factors that are modifiable. These are the factors that we could do something about. We could do something about moderate exercise, 3 to 4 hours a week. We can watch what we drink. Moderate exercising 3 to 4 hours a week, drinking 3 to 4 hours. 3 to 4 drinks a week. And if you don't drink, don't start, and don't yo-yo your weight, and just to try to be as lean as you can. So those are the things that we can modify. So really what's happening in breast cancer is that there's going to be a lot of lesses and a lot of mores. We're going to be able to predict the behavior of your cancer based on a small core of tissue. We're going to do less cancer surgery, less chemotherapy, less radiation. We're going to redefine cancers that are more indolent, the kind of cancers that may not need radiation. We're going to have more targeted therapies, like estrogen, anti-estrogen therapies, targeted therapies like anti-Herceptin or HER2, based on a better understanding of someone's genetics and their pharmacology, like how they process or how their enzymes can break down drugs. We're going to identify more genetic mutations, and there's going to be more sharing of the genetic database, which is really important because right now, since Myriad lost their proprietary license, they're the ones that have the most data, and they're the ones that we're having a problem having them share everything, because not every genetic mutation is important or will cause cancer. As a matter of fact, there are many variants that don't. And we'll do more surgeries with better cosmesis for people who are at risk. We're going to go on. Hold on. So, did anybody meet this guy outside? Okay, this is a big problem. We're having a really big problem with the American Cancer Society, who have now, well, I don't think it's a big problem. I think there's some merit in what they're saying, and I'll tell you what they're saying. Okay. So, did you get your annual mammogram for the women in this audience in 2015? That's an A. That'd be an A. Okay. Okay, so, and there are about 17% of people here that are not over the age of 40, so we would not recommend it to you, youthful people. If you did not get your mammogram yet, do you plan on getting it in 2015? Okay, so for the people that didn't get it, are you going to get it, or are you totally confused by the guidelines? So you won't get it. I mean, there are some, major confusing issues. Well, the bottom line is that breast cancer is mostly moderately growing. It kind of grows like this. The fast-growing cancers, you can miss the cancer on a mammogram if you do it every year, and the slow-growing cancer probably doesn't matter when you pick it up. So mammograms work best in moderately growing tumors. And this is very, very important graph. I'm going to just tell you what the bottom line for screening. So for people who are between the ages of 45 and 55, they're recommending every year. Between the ages of 40 and 44, the recommendation is to talk to your doctor. I haven't given up recommending annual mammograms, but I see mainly people who are at some risk. So if you are at an average risk, you should really talk to your doctor, meaning you have no family history, no precancerous lesions. But there are many limitations of the American Cancer Society's recommendations. They grouped a lot of studies together. They didn't look at people who had very dense breasts, women where you need to have special mammograms, like digital mammograms where they work better in dense breast tissue. So there are a lot of limitations, but what they're recommending is that yearly mammogram from 45 to 55, then every other year until 74 or 75, and then it really at the discretion of the doctor, if you have over a 10-year life expectancy, then you would recommend additional mammograms. The American Society of Breast Surgeons came out yesterday and agreed with the American Cancer Society. This is a dense breast, and you can see where mammograms may not be so helpful, just regular mammograms. So what I recommend is for now, between the age, from the ages of 40 on, every year, unless someone has a lot of comorbidities, meaning they're very sick, or they don't have a 10-year survival expectancy, and then I wouldn't recommend it. Someone who's in active treatment, I would not recommend it either.